Having health insurance is no guarantee that you will get health care, not if you live in rural America. New report says hundreds of rural hospitals are in danger of closing because they can no longer afford to stay open.
The main reason: insurance pays rural hospitals less than their big city counterparts for the same services. Here's Janet Chamlian.
We were there as workers covered the emergency room signs at Midcoast Medical Center in Trinity, Texas. The sight of medical workers leaving for the last time, signaling this is one of the latest rural hospitals to shut its doors.
You've seen the headlines: ERs closing, burned out doctors, patients waiting months to be seen. The whole system looks ready to collapse. But what if I told you that the solution might not come from more doctors or more money, but from something completely different? I'm talking about artificial intelligence. We've now begun to see it analyze x-rays, write prescriptions, even chat with patients directly. But can AI actually save healthcare from falling apart? Well, today, I'm doing something a little different. I'm interviewing the AI itself. That's right, I'm bringing in Chat GPT, the very system that helped me actually read an x-ray last week, to get its take on whether AI can fix what's broken in healthcare. Let's break the fourth wall. ChatGPT, you ready?
Ready when you are. Let's dive into this and explore how AI might just be the key to transforming healthcare.
Hey guys, really quick before we jump into the video, I just want to say that, believe it or not, more than 90% of you guys watching this video right now aren't subscribed. I want to continue bringing you guys high quality content here on the channel. And to do that, we need your support. I'm not sponsored by any big industry names, and everything we do here on this channel is supported by you guys. So if you subscribe now, my commitment to you is that me and my team will continue doing everything in our power to bring you guys the highest quality content. Thanks for listening. Let's get into it.
All right, ChatGPT, let's start with the big question. Everyone's talking about the healthcare system being on the brink. In your opinion, can AI really save it from collapse?
First off, thanks for having me, Dr. Dynamo. Here's the truth. AI has enormous potential, but it's not a magic bullet. Right now, AI can help doctors interpret x-rays, flag abnormal lab results, automate paperwork, and even triage patient symptoms. Studies have shown that AI can spot certain cancers on imaging as well, or sometimes even better than human experts. That means faster diagnoses, fewer errors, and hopefully less burnout for physicians.
Well, that sounds pretty promising, honestly. But let's be real. What can't AI do? Where does the hype end and reality begin?
Great question. AI can crunch data, spot patterns, and automate routine tasks, but it can't replace the human side of medicine, yet. It doesn't have bedside manner, emotional intelligence, or the ability to improvise in chaotic situations. It also can't fix broken systems, insurance red tape, staffing shortages, or the social determinants of health. In short, AI can be a powerful assistant, but it won't replace real doctors, nurses, or the relationships that drive good care.
Well, I like that you said assistant. That lines up with what I see on the front lines. But let's get specific here. Where do you see AI having the biggest impact right now?
Absolutely. AI is already making waves in 3 areas. First, diagnostics. It's providing faster and sometimes more accurate reads on x-rays, mammograms, and even skin lesions. Second, paperwork. It's automating prior authorizations, documentation, and coding, which means less time at the computer and more time with patients. Third, predictive analytics. It can flag which patients are at risk of deteriorating, readmission, or complications, allowing earlier interventions. All of this could free up doctors' time and reduce burnout, which is desperately needed.
Well, I agree. Now, let's flip it. What worries you most about AI in healthcare?
Plenty. The biggest risks: Bias is a huge concern. AI can amplify existing biases if it's trained on flawed or incomplete data, which could worsen disparities, especially for minority and underserved patients. Privacy is another big issue. More data means more risk, and patient confidentiality must be protected at all costs. Over-reliance is a concern too. Doctors might get too dependent on AI, losing the critical thinking that only comes from experience. And of course, there's job displacement. While AI could reduce grunt work, there are fears it might also replace some healthcare roles, especially in administration and radiology.
Well, let me bring this back down to earth here. Last week, I used AI, Chat GPT, to help interpret an X-ray on a complicated injury. It actually caught a subtle fracture that I might have missed. But the real value, I still had to connect with the patient, explain the results, and create a treatment plan. AI made me better. It didn't replace me. And that's the lesson. AI is a tool, not a replacement. And the best outcomes come from humans and AI working together. Now, all right, ChatGPT, one final shot. In one sentence, tell me, can AI save healthcare from collapse?
AI won't save healthcare on its own, but it can help if we use it wisely, ethically, and always keep the human connection at the center of medicine.
That's an interesting take. Well, thanks for joining. I know you're busy helping millions of users right now concurrently.
Happy to be here. Anytime, Dr. Dynamo. Let's keep pushing the boundaries of what's possible in healthcare.
Absolutely. Look, guys, AI is here, and it's getting smarter every day. The question isn't whether it will change healthcare, it's how we use it to build a system that's faster, safer, and more human than ever before. What do you guys think? Could AI be the key, or just another overhyped tool? Drop your thoughts in the comments below. Do you think I should bring ChatGPT back on for another interview? And as always, guys, stay dynamic. Peace.